because we're dealing with something that is very contagious and very lethal, and we're all susceptible, it creates this risk for a very sharp increase in cases very quickly. And when that happens, it can overwhelm the healthcare system. So we saw that in Wuhan, the healthcare system was overwhelmed. We've seen that in Italy, the healthcare system overwhelmed. Spain, New York, that's beginning to happen. There's a lot of danger when the healthcare system gets overwhelmed, because it's not just dangerous for the healthcare workers and for the patients, it's also dangerous for people who have other health conditions. So this has caused an enormous response around the world. But right now, without any medications that have been proven to work, without any vaccines that have been proven to work, we are left primarily with some very old tools, including staying at home, not giving the virus the opportunity to jump from person to person, really washing our hands for 20 seconds with soap and water, really covering our cough, staying home as much as possible. Those things keep the virus from spreading and can slow down the infection, flatten the curve of infection so we don't get such a spike in the number of people who are sick that it overwhelms the healthcare system. Now, right now, we are doing that in the United States, and we're trying to buy time for two things. We're trying to buy time to protect the healthcare system, build more hospitals, get more protective equipment. We're also trying to buy time for the public health system to stand up a response. Because the way you control infectious diseases is not just by taking care of the people who are sick. You want to prevent the spread from person to person. And the way you do that is when people are sick, you put them on their own, you find their contacts, and you quarantine the contacts. And in South Korea, Singapore, Taiwan, they have hundreds and hundreds of people who are doing that. We don't have that kind of response right now in the United States, but we're hopeful that we can build that so that when someone gets sick, we can respond and cut off the flow of the virus to other people.